Welcome. Today is Thursday, June 26, 2025, and at this time is now 9:30 a.m. I'd like to call to order the Alameda County Lead Poisoning Prevention Program Joint Powers Authority. This meeting is conducted in a hybrid format. Members of the public are welcome to join us, Alameda County Training Center at 125 12th Street, Oakland, or they can join us using the telephone and video conference link provided in the agenda for today's meeting. Deputy Secretary, would you please take the roll?
Alternate Arkin.
Here.
Director Gallo.
Present.
Director Jensen.
Here.
Director Tregu. Director Welch. Mr. Chair, you have a quorum.
Thank you. Can you take us through the agenda, please?
There's no public comment. Then we move on to the consent item. Meeting minutes for May 22nd.
We do need a motion, members of the.
Move approval.
I'll second.
Okay, thank you.
Okay. Arkin. Alternate Arkin.
Aye.
Arkin, aye. Director Gallo.
Aye.
Gallo, aye. Director Jensen.
Aye.
Jensen, aye. Director Tregu. We're doing the minutes right now.
Aye.
Tregu, aye. Director Welch. Absent.
Thank you. Next item, please.
Director's report.
Director's report.
Thank you very much. Good morning. Nice to see you all again. I wanted to start off my report with a federal funding update. As you all may have heard, the HUD Secretary recently addressed the House Appropriations Committee and talked about their proposed budget, included the idea of a paradigm shift, reflects a broader administrative path, placing more discretion at the state or local level of how HUD dollars are used. So we are monitoring as that goes through all of the appropriations to see how that would affect the operations of the Healthy Homes Department. As I mentioned last month, we do have 3 HUD grants, and we also the CDBG block grants support our minor home repair program. So any cuts to the CDBG block grant would certainly affect us in that program wholesale. The cuts to the Office of Healthy Homes and Lead as a Control would affect future funding opportunities, not necessarily the ones that we have now. So that's something looking forward and seeing how that might shake out. But we'll come back to this board if there are any concrete changes to the program design or outcomes.
Could I ask a question? Did you see any substantial cuts in the proposed budget?
The way that the president's proposed budget was 0 funding for CDBG block grants.
Oh, for CDBG.
That was the president's proposal, but what seems to be on the floor being discussed is a 50% cut for CDBG funding, and then to roll it to the states. So even just the change, certainly the change in the dollars available, and then the change in how they're allocated.
And it's all CDBG funded,
Well, the minor home repair program is
Minor home repair.
CDBG funded.
but the HUD,
The lead grants,
Yeah.
the older adult grants, the production grants are funded from the Office of Healthy Homes and Lead as Control. That's not CDBG. It's
and is
different.
that cut as well?
Future funding opportunities are going to be cut, not the existing.
So the grant availability will. Yeah.
Yes,
Thanks.
grant availability in the future will be affected, not the current ones. The current ones are funded for 3.5 years.
At the federal level.
Yeah.
Okay.
Yes.
Go ahead.
This may be in the weeds, but are you aware of any substantive differences between the House side and the Senate side on the level of CDBG cuts?
I am not aware. No, good, excellent question. Let's see how that checks out. Also wanted to bring to your attention that we had a successful May awareness campaign in May, working in collaboration with Outfront, where we had billboards from all over Alameda County trying to raise awareness about healthy homes and lead awareness. We had ads in BART stations, public posters, and we focused on the busy transit corridors because people are the captive audience right there. And so the recording was that we got 3.6 million views in May for awareness. The posters did include contact information for us to call us with a QR code, talking about healthy housing. So we're very proud of that in terms of people just being more aware.
Do you have anything at the county fair? Any?
We are, not now, we haven't looked at that yet. Usually for these broad awareness campaigns, we do it twice a year for Healthy Homes Month.
Okay.
And for Lead Poisoning Prevention Month, because they're very expensive, so we have to
Okay.
squeeze our dollars.
Yeah, I just know like mosquito abatement has a booth at the county fair.
Yeah, and we may,
I thought, oh, then I thought.
yeah, we may do something where we can partner, where we
Yeah.
can have our materials there.
Okay, good.
Thank you for bringing that up.
Getting back to the funding, what timeline are we?
So the way I think the September, I think is the target for the feds to do like, okay, this is what the budget's gonna be. September to know what that is, but the way that that we're working with our sister agencies with CDBG funding is that they may have some allocations that we can roll over and continue services for a while before it hits.
Okay,
That's what we're still trying to work out with all of the different jurisdictions, including Oakland, right? It's like, we might have a couple of bucks there. So we can go as long as we can. That's the idea. But September, I think things are gonna shake out
okay,
in terms of what they're gonna do.
all right, thank you.
Okay, you're welcome. Also, in response to the board's request last month, staff are preparing comprehensive presentation on our school outreach strategy and also our coordinated efforts with local code enforcement agencies. The presentation will be scheduled for an upcoming board meeting within the next few months. We're just pulling it all together. Some really good questions from the board last month about how are these things working. Then, speaking of how things are working, I wanted to share with you a brief overview case summary of how a really good example of how we work over cross-coordinating agencies, especially with the schools, because there's been a lot of talk about like how we work with lit in the schools. So I just want to share this with you. Back in April of 23, a child with autism spectrum disorder and severe pica behavior was referred as a case due to elevated blood levels. The public health nurse initiated non-housing source testing, identifying elevated lead in the chalk obtained from the child's elementary school.
Wow.
The PHN successfully communicated the findings to the parents who promptly notified the school to discontinue the use of that chalk. Despite international interventions, and this is something that the case management staff do, they're monitoring the child's blood lead level. The child's level continued to rise, which is unusual if you remove the source. So they got to go back and say there must be something else, right? We ruled out the housing and non-housing sources in the residence. So then we go to wherever the kids spend other time at the school. So what happens is the PHN and the coordinator of the program held case conferences with I think this was with state staff, with school staff about what next steps could be done to try to identify additional sources. So what they did was bring in an environmental investigator to go to the school and test the school for any lead hazards. The coordination with school administrators, and this was an Oakland school, and Oakland Unified School Risk Management led to a scheduled risk assessment in January. The coordinator conducted a site visit with the risk assessor, collecting non-housing samples such as art supplies, toys. They're trying to find the source, which all tested at trace or undetectable levels. Still didn't find that. However, they did identify lead hazards in the classroom's door frame, wall areas near the playground exit. So in collaboration with OUSD, abatement was scheduled on a non-school day. Repairs were completed using certified lead safe practices, and clearance testing confirmed the site was safe following no lead hazards remaining, and the child's level starts to drop. So I just wanted to share with you, now it's starting to, because that was probably a contributory source. So this is a really good example of how you have to really investigate and keep monitoring that child's level, because it should come down. If you're removing the source, it should come down. And if it's not, we got to go back and find that. But that was, I think, a really good example of like working with Oakland schools. As part of this also, just know that they also tested the water. So they're trying to find where it is. So that was a successful case coordinating case I wanted to share with you. Okay.
Can you just, how does the case come to the attention of both the school nurse or school health personnel, but also to Healthy Homes?
So they don't go to the school nurses, they come to Healthy Homes. So to the lead department. So what we have is a surveillance system that is tied in with the labs in Alameda County. that will give us all the children who've been tested in their lead level. So we know almost at the same time the doctor knows. And so a lot of times the parent is talking to the doctor and they're talking to us, and we're like, oh, this is what we're going to do. So that those records aren't going to the school. But it's like, in this case, we're starting at the home first, because that's where much of the lead sources are. But in this case, it was some, but not all of it. And that's why we say if there's a school-age child, the school is involved. So one of the things that when we talked about when the lead and water crisis was happening, it was get your child tested, then we can intervene from like this. You can't intervene if we don't know that there's a lead poison child.
Now, do you find out if that child just happened to be, you mentioned that they had some other health conditions, and if the child just happens to be tested as routine testing, or the child is having some other medical issue and gets tested through their provider, does that report it as
Yeah,
well?
all of them. Any
Okay.
blood lead level comes through our surveillance system.
Right.
Yeah.
Because we have things we work on.
So it's not the water, not the paint, it's the chalk.
It was the chalk and the paint.
Oh, the chalk and
And
the paint.
because remember, they identified the chalk as having an elevated lead level, and they said, okay, let's remove the chalk, and they did. And the level didn't come down. It was actually doing
just
something
the
else.
paint.
And so that is not what we usually see.
Yeah.
It's like when you remove that, then it should slowly come down, but it wasn't, which led us, like, there's something else.
Okay.
So we have to look at where the child, and so this was called like a secondary EI, environmental investigation. There are instances where if the child spends, so let's say if it wasn't the school, it's like, okay, it's still coming up. Oh, they hang out at grandma's house.
Right.
Oh, let's go to grandma's house.
Yeah.
All right, because we have to find what the source is. Yes.
You kind of touched on it, but in a school-specific setting, is there an extent of condition review?
Mhm. Yeah.
Does someone now go out and look at
Mhm.
every
Mhm.
kind of chalk from that particular brand
You know what?
that was procured?
No, that's an excellent question. So one of the things that when we're working in concert with the state is but the state has like all of the results from all of the samples, the non-housing samples that we have, and it kind of creates kind of like a laboratory of information, and they will send out alerts statewide. Hey, I think I almost found this. If you guys have this, right, in their communications. And so, as part of the statewide program, right, it's kind of like there's a library of things. And so therefore there's put out alerts about, okay, this is.
Yeah, that was my question too. Would your department put out something to all the schools in Alameda County to say, don't use this chalk,
Mhm.
or, chalk? or-
We're working from the state, and because
Yeah,
we
but
want
the
to
state does that.
communicate that.
What is the level of interaction with OUST though,
Uh-huh.
specifically?
Okay, in this, I'd have to investigate this particular piece, but in terms of when, part of these case conferences is talking to risk management and giving them the information so they can take it and move forward with it. But I'd have to investigate specifically what happened here, but because risk management is at the table, that's part of what their role is, working with OUSD to make sure that there's mitigating the risk to the children. So
What school was it?
I don't know.
Okay.
This was, it's in Oakland. I know that. It was an elementary school. That's all I know.
Which chalk was it?
Yeah, right. I mean, I can report back on what that was.
Yeah.
But that was.
Can I just ask too, with the normal blood panel with the pediatricians do, I don't think the lead testing is a normal part of parents would have to ask for it, correct?
Well, there's requirements if the child is on a federally funded, like Medi-Cal, they have
Okay.
to, like at 20,
Oh, they
12 and
do.
20,
Okay.
it's required,
Okay.
right? But after that initial, in terms of like a federal requirement, whatever, it's not required, the parent asks for it. But there is a screening tool that providers are supposed to use for children more at risk. Do you live in older housing? Do you have hand to mouth? There's certain things that providers can look for to say, yeah, I think I'm just gonna test.
Yeah.
But the parent can always ask for it, yes.
Okay, because I think that would be a good thing to keep in mind in terms of outreach is all children, when you're taking, if I had young kids right now, I would make sure. I know in Pleasanton, because of our airport, because of the leaded fuel thing,
Mhm.
a lot of parents are starting to ask for it. Can you please,
Got it.
with a
Good.
normal blood panel,
Yeah.
test for lead as well? That would be.
No, that's what we always
Great
push
thing.
that part, because then
Yeah.
we can because now we can take action now. We have a
Yeah.
level, we can do something, but so
Yeah.
therefore let's get the facts, first.
Absolutely.
Excellent question.
Yeah.
Thank you so much.
Mhm.
So just kind of related to the work around lead. Great news on the lead settlement. We've got a meeting scheduled on Monday, I hope, with the Equitable Lead Hazard Abatement Program Work Group next Monday, where they'll provide an update on their work about the recent public meeting and the work that the consultant has been doing. There's some information they want to share with us.
This is City of Oakland.
Yes,
right?
yes. So I'm very excited about that moving, so we can start to talk about like how we can get this program running.
When is that meeting?
Monday, it's tentatively scheduled for Monday.
Monday, is that a public meeting or just? private?
No, it's just a private. I think it's just the work group and Healthy Home staff. Is
Okay, I'll check back with you.
Yes, and so after, certainly before the next meeting, should have a report. Okay, all right. I wanted to, as my last item, just provide each of you with a copy of with a copy of Nora Learns About Lead, which was written and illustrated by our very own Healthy Home staff. We are currently working to get it distributed in some libraries and working with some other partners for, to help us with the distribution, because we just felt that there was something missing in the world of like children's education in terms of lead, and we decided that we wanted it to look like people who we're serving. So
Yeah.
the genesis of this.
Great, wow. this is
Yeah.
really-
See, that's fantastic. Okay, that concludes the director's report.
Can I ask a question? I don't know if this is the appropriate time on the lead settlement stuff. So has Oakland, other than that consultant with the equity study,
Mhm.
has there been any other funds expended from Oakland with
No.
their settlement amounts? Nothing?
Not that I know about, right?
Okay.
Because remember, there's like 3 buckets, right?
Yes.
There's the
right.
4.7 piece that Oakland had
Yeah.
there,
And then
and then
the
there's the
9.5,
county
right.
doing the other stuff, and then there's the other stuff that's sitting there, right? So my understanding was the 4.7 was actually going to be used as part of the planning. So it's like once we get together and say, this is what should be done, there's some things that Oakland already knows it wants to do with the 4.7. I think it's a proactive element
Okay.
special. That's pretty much what that's been kind of earmarked from their planning.
Yeah.
I don't know, because,
Okay.
I haven't.
Do we know how
talked to
much
them.
that study costs? That equity, is that gonna take a chunk of that?
No, I think the proposal that I remember reading was something like a little over 150,000.
Oh, okay, so pretty.
Yeah.
minimal for.
Yes,
Based on all of that. So then, and then there's going to be a plan. Now, from the county funds, the other 9.5 and 9.5 bucket, or the other 9.5, I guess I should say. Do we have I know there might have been stuff in our budget stuff, but any account of what's been spent on what and all that? Do we have anything like that?
For like outside of the city of Oakland, you mean?
Yeah.
Yes, we can bring that back.
Oh, that'd be great.
Okay.
Yeah, thank you.
Okay,
Just to kind of keep that fresh all the time in my
Okay.
head of
Okay.
what we've
what we're doing. Yep.
doing. Yeah.
Okay,
Okay, that'd be wonderful.
very
Thank you.
good, very good. Okay. That concludes the director's report.
Okay,
Thank you.
let's see, any other questions? No? Okay, let's move on to the next item.
Okay, I have something there. The selection of the community representatives. Representative Gwen Hardy has notified us that she has resigned her appointment as the JPA community representative. We thank her for her over 32 years of service on this.
Great.
For sure. So next steps. So it's been many years since we had to dust off the documentations, like, well, what do we do with the community rep? So really, the community representative, just a little blurb from the agreement, is a non-voting member of the Joint Powers Authority. They're selected by the board to speak as an ombudsman for members of the community served by the program. So our next steps are to ask you to think about who you would like to nominate as the community rep to sit on this board, compile the information about their experience, interest, bio, send that to Ladise before the September meeting, Ladise. And she will compile it in a group and to send it out to the packet for you all to review and read so that you can vote in the September meeting. And Ladise will review this and send this into an email too, so you don't have to remember all the dates.
Oh, good.
But does that make sense? You all will bring your nominees and then you
So
all vote.
we're looking for one representative.
One.
Is there any industry or any particular constituency that this?
It doesn't have to be City of Oakland?
Oh, no.
Oh,
No.
Because I was
It's the
thinking
community
like
rep.
first five, having someone from first five would be kind of good.
Will there be any kind of blurb or community announcement we can send out?
Oh, that's a good idea. I don't know, Ladise, can you maybe just describe it and send it out in the email instructions and you all can
that's something that we could probably do. This is the very first.
It's the very first time we've done it, so we're like, I think so. Yeah, it makes,
A possibility.
sure, and so with the instructions to, contact your JPA board rep, so that, you want to step forward and say then, because it would be you all who are bringing the nominees.
Yeah, and by which date?
It's by like August 30th, we'll say August 30th.
Yeah. That should give plenty of time. Right?
Yeah,
What I can also do, I can send you information about a brief description about the board so that you're able to relay that information to your nominees.
that's great,
That'll be great.
great.
Then we forward that information.
To Libby. So she can compile it all and you would have a chance to review it before the meeting.
Okay, good.
Right, so that, you're voting from.
Okay.
Yeah, the plan is to have this as an action item in time for the September meeting.
Okay, good. All right.
Is there not that I expect to get a lot of applications, but is there a limit on a per board member basis? Or do we choose more
Oh,
than one comes into
interesting.
one or more of us?
Yeah, in terms of like a limit of nominees per board member? Is
Yeah.
that what you're asking? I don't know that is, I think that's up to you.
Yeah. I think by the time it gets to this board, you should already looked at which candidate you would like to
Yeah.
prioritize.
Yes.
Mhm.
Why don't we each take, should say representative that we can refer, then we'll have that discussion.
Mhm. What's your?
I mean, you're right, because there's some nonprofit groups here that are gonna submit a
Mhm.
number of names so that we
Yeah.
can work on that.
Okay.
And the deadline,
August 30th?
All right.
But you're gonna send out an email following this meeting.
I'll go ahead and send you additional information that you can use for just a reference and also for you to send to anybody that you feel might be interested.
Okay, good.
Okay.
Okay. Let's see, next item, monthly report.
You have the monthly report, which reflects information for the month of May. I would like to just highlight one item for today's meeting. We attended the National Science Foundation Day event in Berkeley. This is the event. It's hosted by a program, Bay Academy of Young Scientists. They do extensive work around lead, and that's one of the reasons why we went to that event. This organization or program has done extensive testing in households in some Oakland communities. So they have raised awareness about lead and also its origins in the community. At the event, they were offering lead testing for 50 households. They were collecting dust, soil, and water samples. The department connected them with the Eden Area Community Group for extending their research, and this will, cover the unincorporated area of the county. That's what she has.
Right.
Thank you. Was this open to all community members, this event?
Yes, this was a public event where we did an informational booth, and again, we were partnering with them to continue to raise awareness about lead.
Thank you. And I apologize if I missed this, but was there information forwarded to the board or to me as the Berkeley board member about this event?
Mhm. So would you, just to follow, any particular events you want information on? We don't want to inundate your inbox, so.
Yeah, I appreciate it. We have a monthly newsletter and we're
Okay.
always happy to get
Oh.
community events in Berkeley
Oh,
out to my
Fantastic.
constituents.
Oh, that's fantastic. Okay. So we can contact you about making anything. That's that. Thank you. That's an excellent resource.
Is there any type of flyer, social media post, anything that I could put? I'm the one responsible for Supervisor Miley's newsletter. I do a
Yes.
newsletter every month.
Yes.
I'd love to, it doesn't have to be event specific or
Yes, just a word.
anything like that, but just
Yes.
an awareness of, I'd like to, sometimes I'll do a department spotlight for the county or something, and
Mhm.
I can
That is
I'm
fantastic.
working on July's right now, so,
I'll put you in contact with our coordinator.
okay, that'd
get
be
that
great. If
for
I
sure.
could get some graphic and
Mhm.
little text, I can put it in and it
Thank you.
just, it'll get to, you know,
Thank
got
you.
quite a big list of recipients, so.
Thank you so much.
Yeah, of course.
A board member, is there a contact person we can do for your newsletter? Or should we get that from you when we can? work
Yeah,
with
I
anyone?
can provide that to you.
Okay,
You can use my general mailbox, but may I suggest as you have these, well, I don't know, I can only speak for myself, but it might be useful to get a forward-looking list of community events you plan to do.
mhm.
And then we can kind of pick and choose and decide which ones may be particularly applicable to
Oh, I see.
our constituents.
Okay, good, sure. Not sure how forward we look, but there's some. Okay. Okay, it's up on the monthly report, okay.
Next item is future agenda. items.
I already mentioned the one about the settlement fund,
Mhm,
kind of recap and
mhm.
analysis, whatever you want to call it. And I mentioned last time, and again, no hurry on the Livermore Airport issue. with
That's
it.
right, that's right.
But
You're right.
That can be
Yes,
whenever.
yeah.
Yeah.
Thank you.
Okay, thank you.
Thank you for that, yes.
That's it for me.
All right, any other items, future agenda items? Administration, from administration? No, not at this point. All right.
I'd like to maybe actually see, if, follow up on if the forward-looking, just discussion of community events that are
Mhm.
done, including any that are regularly done on an annual basis or
Mhm.
quarterly basis, as well as any one-offs or
Sure,
Okay.
additional ones.
great.
Announcements.
Oh, I want to ask one more.
Oh, go ahead.
With regard to, it's only my second meeting, but that example, the example that you provided, that was really helpful, just to understand, for my understanding of how,
Mhm.
intervention works, how the case
Mhm.
managers work. So
Mhm.
if you,
I do plan on bringing something every meeting. for you.
oh, good. Thank you. Maybe you've already done that all.
No, I hadn't, because as a new board, and actually, I think it puts it really on the ground.
Really did.
So there will be some cases, there'll be some lead remediation on the housing side, so I do plan to do that.
Thank you.
You're welcome. Thank you. I'm glad it was helpful.
Let's see, number announcements by board members. Any announcements? And the only thing that I would advise that I like to do if the other members are available is actually visit or witness a location where there's that lead in the paint.
Oh, you like to go on site?
Pretty, just see how it's done.
Okay.
And because the other one that interests me is Children's Hospital, when a
Mhm.
child is taken, I mean, how does that work?
Mhm.
Where do they do that? How do you get that information back? Just to be able to
Understood.
witness the process that
Okay.
goes through. Because
Okay.
what happens in my community, there are a lot of parents who would be reluctant to, considering the immigration thing.
Right,
that's going
right.
on, where
Okay.
certain housing conditions, but I'm not gonna step out of line because,
Yes. Okay, so that I really,
there may be a repercussion.
I think we have lots of cases like that. So
Yeah.
maybe I can have either myself or have staff come in and talk about how they work with families and from that particular situation, because we do. Right, and so they all have an understanding about kind of like
Right,
those
right.
There you
sensitivities,
go.
but they still do need the services. How do we do that? So I think that would be a great one.
That's a really good point, because a parent who might have a child that's been exposed
Yeah.
would be reluctant to either tell the landlord
Yeah.
or report it to.
Oh, yeah, because then they're gonna get.
Right. So, okay, I'll put that on a
Yeah,
future.
so we could all understand how that works.
Okay,
Any other announcements, members?
I already mentioned it earlier. Neither I nor Supervisor Miley will be at the September meeting. So they're for quorum purposes and everything else.
Okay.
Because of his flagship event every year. So I will be, nobody from
now at the September meeting.
September.
Okay,
There's no meeting in August.
no meeting in
Is
August.
that the old
Healthy
Senior.
Living Festival,
Yeah.
yeah, the senior, yeah.
Is it the zoo?
It's at the zoo. Mhm.
All right, so any from administration, we're fine.
Nope.
They have the information. So with that, the meeting's adjourned. Thank you.
Thank you so much.
Thank you.
Oh, yeah, thank you.